Thank you for visiting our website and showing interest in Advocate Lutheran General's Cardiovascular Fellowship Program. Lutheran General is a 623-bed clinical, academic, and research facility that has been serving the northwest suburbs of Chicago and beyond for over half a century and is home to our Cardiovascular Fellowship Program. This fellowship is more than 30 years old, and it is a 36-month training program that is fully accredited by ACGME. Here at Lutheran, we have a very robust curriculum. We provide rotations in all disciplines of cardiology: cardiac cath lab, CICU, consult service, echo stress lab, EP, imaging, nuclear cardiology. And this is further supported by a large volume of invasive and non-invasive procedures. In addition to that, we also offer unique exposures that other programs may not offer in areas such as CV surgery, vascular surgery, cardio-oncology, lipidology, structural heart clinic, and soon cardio-obstetrics. We take 3 candidates per year, so we have a total of 9 fellows. We are very proud of our faculty. We have exceptional faculty. They have demonstrated unique mentorship capabilities. There is a very strong connection between the faculty and the trainees, and that has provided really a very positive learning experience and a warm and friendly environment for our fellows. We really feel like we are a family, not just a training program, and this highly promotes the well-being within our fellows and a program as a whole.
Advocate Lutheran General Hospital Cardiovascular Disease Fellowship provides a well-rounded training experience. While working alongside experienced yet approachable attending physicians, you will participate in numerous EP and interventional procedures, interpret an extensive variety of imaging studies, and most importantly, learn clinical cardiology skills during multidisciplinary rounds. In our state-of-the-art cath lab, we perform approximately 2,100 diagnostic procedures, including left heart caths and peripheral angiograms. Of these, approximately 1,400 are interventional and structural procedures, including left atrial appendage occlusure devices like Watchman, TAVRs, and transcatheter edge-to-edge repair like MitraClips. We do approximately 600 PCIs and over 2,100 electrophysiology procedures such as ablations, devices like pacemakers and defibrillators, and diagnostic EP studies. The exposure to these procedures and many more in our cath lab is a highlight of our program.
I'm Dr. Katie Mikrit, the Director of Advanced Cardiovascular Imaging and the leader of the Cardio-Obstetrics Initiative at Lutheran General Hospital. I completed my internal medicine training and cardiovascular disease fellowship at this hospital and my advanced imaging training at The Ohio State University. I chose to come back to Lutheran General and join the faculty as the level of collegiality between the partners in the group, cardiology fellows, residents, and other staff members is unparalleled. The constant drive to improve the quality of patient care, education, and the growth of our practice makes Lutheran General an exciting place to work.
The Cardiology Fellows Office is our oasis where we can rest, gather our thoughts, and study. It is conveniently located next to our dedicated conference room, where we participate in daily noon lectures, weekly cath case review conferences, weekly echo conferences, our monthly CME multidisciplinary conferences, EP conferences, journal clubs, and more.
Our outpatient continuity clinic sees an average of 215 patients daily. It is structured to prioritize and nurture the longitudinal patient-physician relationship and expose fellows to the outpatient diagnosis and management of acute and chronic cardiac conditions. In addition to the continuity clinic, our program also offers specialty clinics, including Watchman Clinic, Adult Congenital Heart Clinic, Heart Failure Clinic, Lipid Clinic, and Structural Heart Valve Clinic. Each Fellows Continuity Clinic is under the mentorship of one of our dedicated faculty members.
Hi, I'm Sonika Tolia, one of the second-year cardiology fellows. One of the first things that attracted me to this program was the cohesiveness of the teaching faculty. I rotated through a cardiology rotation here during residency, and my favorite part was the morning reports. Every morning, all the subspecialty attendings and fellows rounding on those respective services came together to discuss every patient we were consulted on. They discussed challenging cases, teaching points, landmark studies, and overall just brought a well-rounded approach to every patient's care. Participating in this for the last 2 years tremendously helped my foundation in cardiology.
Hi, my name is Joseph Adams. I'm a first-year cardiology fellow. I chose Lutheran General because it's a perfect hybrid of academic and community hospital. There's an abundance of pathology. It's a level 1 trauma center and tertiary center, and so the pathology is great here. And also you get the community aspect feel of the program too. And the people here are great. The faculty love to teach, and the teaching is very much clinical based. And I love the hands-on experience that we get here, procedural experience as well. The teachers as well and the faculty are phenomenal. They're very focused on our education and our growth. And so that is one of the other reasons that I chose this place.
Hi, I'm Chad Moriali. I'm a third-year cardiology fellow here at Lutheran General Hospital. The type of training you can expect from our program is a very strong clinical and procedural experience where you're working one-on-one with the attendings. Secondly, we have a very diverse patient population and pathology being so close to O'Hare, which is one of the largest international airports in the world. Thirdly, you have the ability to customize your cardiology training to what you envision your career to be. If you'd like to do interventional cardiology, structural cardiology, electrophysiology, advanced imaging, heart failure and transplant, or even lipidology, you have the ability to really tailor your 3 years here at our training program to get exactly what you'd like out of your training and become the best cardiologist you can be.
The fellows learn and polish their echocardiography skills in the heart station, where an average of 9,800 transthoracic and 830 transesophageal echocardiograms are performed annually, in addition to roughly 460 stress echoes and 850 stress tests. In 2023, we performed 354 cardiac MRIs, 264 coronary artery CTAs, 92 structural cardiac CTs, and over 1,300 coronary artery calcium scores. The volume of the procedures that our fellows are exposed to not only exceed ACGME requirements, but also ACC COCAT requirements as well.
We have some of the most dedicated and driven individuals in our program who constantly amaze me with their motivation and eagerness to learn. Our fellows have an interest in many different subspecialties within cardiovascular disease, and it's wonderful to see their interest in these subspecialties grows over their 3 years as trainees. Our fellows, I would say, are confident, compassionate, enthusiastic, and focused. They are team players, and this is evident when you see them interact with patients and with each other.
Our program prides itself in the robust nature of our curriculum, the amazing, dedicated faculty who provide unparalleled mentorship, and of course, the future of cardiology, our incredible fellows. We strive to provide an academically and clinically rigorous training experience, resulting in trainees with outstanding skills in general cardiology and beyond. We thank you for your interest, and we look forward to hearing from you.